welcome back to my channel. I am licensed clinical psychologist, Dr. Kristen Casey, and I'm here to talk about emerging trends for psychologists in 2023. The American Psychological Association, which is a scientific and professional organization that represents psychology in the United States, they released their Monitor on Psychology, which is a magazine that's released 8 times per year to discuss, trends relating to psychology and psychologists. I know some people may think that psychology is a soft science. There is so much research that goes into creating evidence-based treatments, to creating an idea of what is helpful and useful and effective in the field of psychology. There are 11 trends that they focused on for 2023 that I think you would find really interesting. The first trend that I want to do a deep dive into is the fact that scientists are reaching a wider audience. So the APA suggested that it's unlikely that people beyond those who publish their work in a scientific journal will actually read the psychology research, which is why it's so important for us psychologists to be out there talking about this research. Reaching a wider audience also includes psychologists taking to social media to share their clinical advice, their scientific findings with a broader audience. It's also really important to take into account the ethics. Because a psychologist is talking on social media, it does not mean that they are your psychologist. You should always take your own psychologist's advice when you're thinking about your mental health. The APA suggests that there's also been an uptick of psychology podcasts with hosts finding new and innovative ways to pull listeners in and provide them with valuable information. The whole point is to get this research out there. One of the gifts of social media is that it can help us access these hard to reach audiences. It helps to break down the barriers and increase access to mental health care information and mental health care in general. Not all of us psychologists have been taught to communicate with the public in this way. So there are a bunch of us on social media, not all of us, and it doesn't mean that somebody's better than somebody else. It just means that some people are more comfortable being in front of the media. The APA also focused on what psychologists look like, which this has been a hot topic on social media and in general. The APA suggests that more and more psychologists have noticed that communicating with the public through social media is crucial in breaking down stereotypes about what a typical psychologist looks like. Many people still think that psychologists are older white men with beards, and this needs to change. They also talked about the rise of psychology podcasts. Back in 2006, 22% of the adult population in the United States was aware of podcasts, according to Statistica. By 2021, 78% of adults listen to podcasts, and it's estimated that podcast listeners will surpass 160 million in 2023. This is a great opportunity for psychologists to step in and talk about all the research and talk about the trends and talk about mental health in a way that is digestible, that people can understand. I have a podcast with 3 other mental health professionals, and it does take quite a bit of time. And that is what the APA also talked about. They said engaging with the public through social media or a podcast takes a significant amount of time and often must be done between busy research, teaching, or clinical schedules. But more and more psychologists seem to be discovering the benefit of this work. I am too. I think it's incredible. I personally was very hesitant to get on social media. I didn't know how the public was going to take us psychologists being in this space. I also think it's really helpful to reduce misinformation, which is another one of the trends that the APA suggested for 2023. It's also important to note that in 2021, 72% of US adults use social media. We also have to be very mindful about the integrity of our field. Psychologists use research to guide their clinical application. A lot of times, how I was trained, we use research to guide basically everything. So if it's validated in the research, it means that it might be viable and helpful for a certain population. It doesn't mean that every single thing, every single intervention that we use in clinical experiences has to be evidence-based all the time. I do think it's really, really helpful to have measurement-based care to predict outcomes, right? We want to know if therapy is helpful and useful and effective. There are a lot of other trends that the APA has noticed for 2023 as it relates to psychologists. I'm going to label a couple of them, and in the comments, let me know which ones you want me to go in depth about. The next one is psychologists taking an aim at misinformation on social media. Psychological research becomes more inclusive. Psychologists are challenging the traditional ways of disseminating research, including how it's conducted and who it includes. So we're noticing more diversity in samples, which is incredibly important because the whole point of research is to research small samples or larger ones and have them be generalizable to the audiences in which they're intended for, or the audiences in which we're using this clinical research for. If I'm doing research and someone else is reading that research, they want to know that they may have been included or represented in some way. Another trend for 2023 is EDI roles expand. So the world is looking for leadership around equality, diversity, inclusion. There's a shift in focus in deepening these EDI roles. And these are roles that psychologists are stepping into. Another trend for psychologists in 2023 is that we are focusing more on worker well-being Worker well-being is in high demand right now. A lot of people are discussing burnout. They're talking about how they feel really exhausted all of the time. We're noticing that businesses are pairing themselves with psychologists in order to create more equitable and helpful workplaces for their employees, especially as it relates to their mental health. There's also efforts to improve children's mental health in terms of the youth mental health crisis. We're exploring ways in which we can reach youth generations. We also saw that suicide prevention gets a new lifeline. That's really, really exciting for frontline workers, for psychologists, for anybody in the mental health field. It shows that the United States is taking the mental health crisis seriously, and that's exactly what we want. It's unfortunate that people are experiencing this, and we need people to be aware of it. We're also noticing that partnerships accelerate progress in the mental health field. So psychologists are pairing themselves and joining forces with other professions. They're joining forces with brands. It's really, really helpful to kind of push that narrative of let's focus on our mental health and let's look at what's helpful. We're also noticing that some psychology faculty are exiting academia altogether. With students feeling overwhelmed and faculty feeling unsupported and overworked, some psychologists are actually abandoning academia, which is alarming. Not so shocking though. We could always get into that. Another trend that we've noticed is that venture capitalists are shifting focus. So new funding is focusing on mental health apps. I'm sure you've seen some of them. There's also this notion that these platforms are including coaching and artificial intelligence, which is very interesting. Finally, we've noticed that psychologists are rebranding the field altogether. Psychologists are noticing that we're not just useful in that one-to-one therapy, one-to-one assessments. We're actually able to strengthen the psychological healthcare across entire populations, which is exactly what we want. If it were up to me, I'd be able to provide therapy to a couple of people, of course, but we want the reach to be expanded because we're experiencing a global mental health crisis. As a psychologist, I find it to be one of my almost like ethical duties to provide the public with information that is viable. Thanks for tuning in. Please comment and let me know which trend that you want me to go into depth about. Today we talked about social media and how psychologists find themselves in public platforms and engaging with the public to disseminate their science and research and really talk about psychological experiences without all the jargon. If you found this helpful, please like and subscribe, and I will see you next time.